God, because I know a big part of your channel is creating these stories of there were these patients or these cases. When Flocka was around for a bit, that was insane. What's that? Oh, you guys didn't have Flocka up here. Flocka? No. Flocka. You have three no's. You should try not getting, is this the gentleman known as Waka? Waka Faka. Yeah, he just ran through my area every once in a while. Like, no, it was a street pharmaceutical that people were consuming. They were smoking it. Is this like bath salt? Not as, didn't seem to be as violent. It was just they were all naked, every time. But they were no longer attached to our reality. The weirdest thing, dude, is every time I ran on someone that was on there, they said that they were being chased by wolves. Every one of them. I was like, are they actually going to another reality? Like, what's happening here? You don't have wolves in Florida. No wolves in God. That would be a whole new, that's in Minnesota. But a few of those, and you get there and they're legitimately, they're looking through you. They're no longer, I think that's the scariest patient you ever deal with is someone, I don't know if you've ever had that, but I mean, of course, to some degree, especially someone's sundowning who's older in the nursing home, because we spent time in the nursing homes, those people forget about it. Like, dude.
Yeah.
Yeah, but they're so sweet otherwise.
Yes.
Which is why seeing that flip is whoa.
Oh yeah. Oh yeah.
But they're looking through you. They don't know what's happening. They're scared because whatever they smoked is detached them from reality. And those are the moments where you're like, crap. Because if this could go south really fast, they could hurt themselves. So we give them some sedatives, and I've had a couple of them. We give them some sedatives and boom, they're right back and they're like, hey, what's going on, bro? I'm like, I've never heard of this crap. This is years ago. Are you seeing more substance abuse cases now? No, it's actually decreased a lot in Florida. Really? They used to call us the Narcan crew, the Narcan crew. Dude, that was bad. What? Wait, what? You had a time with, oh my God, during the peak of, they called it the pill highway. There were so many physicians, pain clinics down there that were prescribing medication or opioids to people. They were coming down from other states, going to multiple doctors. They called it doctor shopping, going to multiple doctors and then driving back up. But we had a point where I don't know what type of opioid it was. But this, we would show up on overdoses. There'd be two of them, two people at one time, which we had never really seen in our area. And they're right next to each other. We were giving them 8-10 milligrams of Narcan. And I mean, it had to be fentanyl. Dude, I've never seen anything like this. I didn't touch them. You normally give somebody 5.
Yeah.
They wake up screaming.
Yeah.
Yeah. Or you just slowly titrate them. I actually, I don't wake people up anymore. I just get their respiratory drive back to normal.
Yeah.
Comfortable.
Oh yeah.
You bring them to a safe place. Yeah. Cause you watch people slam 2 milligrams of that stuff and you're like, this is not good for anybody. They have now vomited all over all of us and they're not happy. So, but yeah, that was 2 milligrams, 2 milligrams. Nobody's waking up, supposedly. I don't know if it's true or not, but I teach CPR. A lot of my clients are treatment facilities. They do CPR so much that they need some difference than someone coming in. Yeah, the press on the dress. So supposedly there was someone who got busted in Miami, the Miami area. And after that, that's where because it was like overnight. It was overnight it stopped.
Wow.
Whether that's true or not, who knows? But yeah, that's so scary. The amount of differentials you have when you go to a case, like what do you know? when you go to a call. Like for me, before I walk into an exam room in an outpatient setting, I'll know the name of the patient, the age of the patient, the reason for the encounter, and my nurse will grab or CMA will grab a brief history along with the vitals and present that to me. Now I can go in with knowledge of what's going on. What do you know? So we'll get the basics. We'll get the address, whatever the type of the call is. If it's chest pain, short or chest pain complaint, do you call it a chief complaint? Call chief complaint? Yeah. Which I don't really love because it's like your heart stopped. You're not complaining. Like, well, we don't walk in and go, his chief complaint is cardiac arrest, guys. Yeah, we'll get just the basics of what's going on. But it's funny, bro, because you take that with a grain of salt. At least for you, they've gotten a set of vitals and kind of an updated stuff for us, like you said, especially telemedicine. You know, for you, they're describing something. They may not understand how to describe it properly. Or if you don't ask that one right question, like is radiating or anything like that, you don't know that their aorta is currently tearing in half. So God, how would you get vital signs if you needed? Would you just, if there's a dissection of no, I'm just saying like during your telemedicine piece, there is no vitals for a telemedicine piece. There are now companies creating devices where if people want to, they sell them the device and a membership to this telemedicine service where they can put on the devices and the doctor can use those vitals. And some of those devices actually allow you to like look in their throat and ears and things like that. Not widely adoptable, but they were being sold at Best Buy at one point. Wow. Yeah. I have my own little blood pressure machine at home. Omron. It's a great machine, dude. Like I'd gone through 2 or 3 of them and some of them were just wildly inaccurate.
Oh, really? Was it the size of the cuff that was the issue because you have big arms?
Yeah.
Got you.
I think it was, or it might have been, I tried different placements of it. And then I learned something I never knew. Dude, I didn't know that your blood pressure is the highest when you wake up in the morning. Is it the highest? It's supposedly higher than normal. I would say from the cortisol spike of just waking up. Yes. Yeah. I wouldn't ever say like wake up and check. Well, that's what I was doing, Dr. Mike. I was waking up. I was like, Jesus, why is my blood pressure so high? That was fun. Just being able to, I developed high blood pressure out of nowhere. Just like personal note, I started getting headaches at the base of my head. And I worked with this company called Detect Together. They're cancer prevention for firefighters. And they have a 2-week rule. If you have any symptoms for longer than a 2-week period, you should get it checked out. So for 2 weeks, I was having, it was great. Great messaging. I had just pressure headaches at the base of my skull all the time. So I was like, I think I have a tumor. That was my first thought. Well, you went on WebMD, obviously, symptom checker. Yes. But I was like, let me just check my blood pressure. And it was like 155, 160. And then my diastolic was closer to 100. I was like, I work out every day. My pulse is naturally in the low 50s. I was like, this is not normal. I was eating these pre-made healthy meals, sodium rich. They were so sodium rich, man. And I don't eat any sodium. So I end up going on a low sodium diet, ended up working itself out, and it's good now. So yeah. And were the headaches related to that? Yeah, that's what they was. Yeah, because it's very unusual to have a headache from blood pressure unless it's really high. I mean, the 100 diastolic, now you're getting into that number. But I had a patient the other day, came in for bilateral leg swelling. And obviously, whenever you have leg swelling, especially in someone who's older, you're worried about a clot. She's not moving around much. but it wasn't the type of swelling that you'd have from a clot. It felt like pedal edema from congestive heart failure. And her heart had some issues, but not to the degree where I would say, oh, we need to implement diuretics. And her echo did not show congestive heart failure to that degree. I said, look, this doesn't make sense. Are you eating anything really salty out of nowhere? She goes, no, like I add no salt. I don't do this. I'm like, do me a favor. Keep a journal. Well, we'll do an ultrasound to rule out clots because like you want to be thorough. There's no radiation, low risk test, but keep this journal. She goes, there's nothing obviously on the ultrasound, messages me on the messaging portal and goes, so the Pudo I started implementing in my diet actually is very rich in sodium. I'm like, wow, I thought that was pretty common knowledge. Oh my God, it is not, dude. That's so funny. I worked for a physician's office for 6 months before I became a medic. I think I was just an EMT at the moment. I was getting ready to go to medical school. And I was doing what your nurses do. The patients would come in, I would do my basic stuff with them, check their vitals, all this stuff, and wait for the physicians to come in. So I had this patient come in, they had CHF, and they were like, I just feel really dehydrated. And I was like, just drink more water. Just like you got to drink a lot more water if you don't want to feel dehydrated. Oh, dude, they can't breathe. The doctor comes out. He goes, hey, you tell that patient to drink more water. I go, yeah. He goes, Jesus, bro. Like, I swear to God, exact words were, stop giving people advice. I was like, I'm sorry. That happens a lot. From well-intentioned advice, I've even seen this with residents where this is a hyper-specific case, but if someone has a thyroid cancer that's been treated, sometimes they would give additional thyroid hormone where to really make sure that your levels are super low of TSH so that you don't regrow this cancer tumor. And because of that, if you check just the TSH, you'd say, oh my God, we're giving them way too much thyroid hormone. But it's being done purposefully so that we don't regenerate this cancerous tumor. And then the resident will start adjusting it. And I'm like, whoa, 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 whoa. Whoa, you're going to regrow their tumor. Please don't do that. God. And sometimes in healthcare, you learn very quickly that why it's so humbling. Just because something makes sense, it might not be the right move. Or just because you have the right intention, it might not be the right move. And very, very tricky to figure that out. That's what I love about like physicians and people that are just truly good at what they do. Like I was saying before, when I watch like certain TikToks or whatever, and you just listen to, so that double board certified guy, like I listen, I'm like, dude, this guy is incredible. Well, there's a new genre. It's called competency porn, where you just watch people who know what they're doing. It's why The Pit, I think, is so successful. Do you watch that?
Yeah.
I don't watch it, but I've heard nothing but incredible things about it. Because it's just like watching people who are really good at the thing that they do. Because we kind of live in this era where on social media, there's a lot of people who claim they know what to do. Yeah, when push comes to shove, they don't know. Yes, I don't. Are there people spreading misinformation about fire safety? And not really, man. Most people are pretty good about it, thank God. No one's selling like a miracle rescue kit or something. No, but dude. And again, some of the stuff is still preliminary and coming out. But like you talk about like the guy that wants to adjust something that's really going to screw something up. By the way, I had a lady go into a 3rd-degree heart block because her cardiologist gave her calcium channel blocker and someone else gave her a beta blocker. And they must have not communicated, or she didn't tell them, and like really messed up. So lithium ion batteries, for a long time, they were, and stuff is still coming out about this, but taking fire blankets, putting them over the cars when they're on fire, and it extinguishes the fire, then allows it to cool down. It doesn't keep going into the thermal runaway, is what it's called. Well, what they found, again, still stuff coming out about it, was that you're trapping all those very dangerous explosive gases underneath that essentially a tent, but under that blanket, and it could make an explosive environment. So, and like, you damned if you do, damned if you don't. Like, what's the best way to approach these things? So now that we have more EVs and charging stations, are there fires related to those? Yes. No. Really? Yeah. I don't know about the charging stations themselves, but your car, yeah, you're going to see more fires that with EVs. It's inevitable. I forgot if this was Secretary Pete Buttigieg or someone was mentioning to me how, because these EVs are heavier on the highways, for example, the barriers that prevent people from sliding off are now not strong enough because these cars are heavier. That's crazy. That now roads have to be adapted, etc., for the electric car environment. Is there anything you guys are doing differently when you come to a car accident scene when it's an EV versus combustion engine? Our biggest thing is we don't want fires to happen at any point in time. And it's so rare that you see a combustion, regular gas fueled fire starting, or on a automotive vehicle starting. These EVs, it's the hardest part is we just don't know what to do yet. We don't know how to fight them. I mean, if it goes into thermal runaway, if it catches on fire and it's just the components around the batteries on fire, it's not a big deal. Water is going to be totally fine. But if it goes into thermal runaway, which is one battery overheating, then catching the next one, and if it's inside of that actual compartment or inside of the pack itself, we can't access it. So we can spray water on it all day long, but it's not getting in there to cool it down. So we can cool the battery pack, hopefully, if it's just that, and hopefully cooled enough to where we can prevent the thermal runaway. But the big issue they're having is when they cool it down, then you have a tow truck show up. When it moves, it can set back on fire again. So they're putting him inside of dump tanks. Wow. It's like a bomb squad is coming out. Yeah, Jesus. It's not as common as people make it out to be. And anything new is terrifying. Of course. And so they're coming out with different things where you can take a nozzle, put it underneath there, specifically made to just drench it and hopefully cool down the thermal runaway. But then they're having piercing ones where they'll go in, they'll pierce the battery pack, and then put it out. But our big thing is just trying to cut off the electricity and then kind of go from there. Create the safety there. Like in my race car, I have a fire extinguisher, but it's not a handheld manual one. I have a giant red button that I have to press, and I think it just explodes in the car. Yeah. I don't know if it explodes. No, I think right? Isn't that what we haven't had to use it? Thank God I haven't had to use it yet. But what's funny? So I crashed my car in Indiana. Great job, Mike. And smoke billowed inside the car. I don't know how I knew because I shouldn't have known. But the smoke was coming from, I hit the rear tire against the wall, and then the tire kind of got jammed. So as the car was rolling to a stop, the brake and everything created a bunch of smoke. It wasn't actual fire smoke. It could have easily been a fire smoke. And there should have been a world where I considered pushing the button. But I didn't at all. So if I press that button and something, they said it explodes, there's maybe, hey, listen, I'm not an expert on all things extinguisher. I can tell you back in the day, they used to have little hand grenade ones where you threw it in there and it exploded. Exploded. Did you ever use one of those? No, dude, we're talking years, years before. I could see you guys in the firehouse just messing with each other, just like, yo. No, but there is a story about that, where a guy, we get there, the guy had pulled the pin and thrown a modern extinguisher into the fire, and it didn't put the fire out. It's not going to. He threw the the whole extinguisher there. It doesn't do anything. Does it ever explode? I mean, it might if it sits there for long enough periods of time, but I can't imagine that that would end up happening. So for yours, I'm not sure. It may explode, or it may just be that it is charged with whatever that chemical is, that agent that's going to put out the fire, because I assume it's spraying in your gas tank area, as well as, is it also going in the engine?
I think it's exploding everywhere.
Everywhere. Well, and I don't know if exploding is the right term, but it's clearly not, it's bolted down. It's not like a point and shoot thing that I pick up and shoot, and you just punch that baby. So you punch a button, there's a button, and it reminded me, this is such a random thing to bring up, but it reminded me of the button that I flew in an F-16 with Air Force Thunderbirds. And they were like, hey, just so you know, this is the button and this is the seat thing in between your seat. Do not touch this unless like you're ready to jump out. And I'm like, wait, why are you saying do not touch it? What if I need to jump out? And they said that this is a bilateral switch. So if I pull it, the pilot also gets thrown out. As this thing's worth like $1,520, 20 million, they're like, do not do this. Oh my God, the level of trust.
Yeah.
To just send in a YouTube dude and be like, yeah, just don't pull that. That's $15 million. And you got to be the right YouTube guy, because there would be people that would push that. And what's crazy is it's not like you have a parachute on. Your seat is the parachute. Your seat gets what, dude? Again, respect for people that created that. Like someone was like, respect. Who uses that comfortably? Yeah. No, I'm telling you, those Coast Guard guys, when we go out to those ships, I told you this before, that like literally, he's like putting, and I'm not comfortable on boats, period. My biggest fear in life is being 12 miles out, my boat goes down, and I got to just sit there and burn in the sun because I'm a ginger. But please, literally putting that on me, and he's like, you know, just if you go in the water, I'm like, hold on, bro. Aren't you the Coast Guard? What do you mean if I'm in the water? He's like, things happen. It should inflate. Oh my God. And then I'm like, then what happens? He goes, they should send a helicopter. I'm like, dude, what is happening right now? Like they should. I love that it's always should. Yeah, I'm positive this guy was like, I'm going to mess with this firefighter. But they're like, dude, just 6-foot waves, just go. You know what's interesting? Given the era in which we live, where the majority of the country is either overweight or obese, are you going into scenarios, into people's homes, where someone is extremely obese, morbidly obese, and you need to get them out? Like, how do you handle that? Thankfully, we've been able to adapt. And if it's really bad, I'm saying 400 pounds. 400 pounds. Anyone over a certain weight, I couldn't give you that exact. We can call a unit that is specifically for that, really. I've only had one patient in my 18 years of being at the fire service where I had to call another unit to transport them just for their own safety, because they have OB units or not obese units. Thank you. obese units, where they can, bariatric units, where they'll show up and it's a wider stretcher with a bigger vehicle. Well, that I get, but actually moving them, how we'll figure it out, man. So if they are down on the stairs or like, we're going to grab feet.
Yeah.
Straps. We're going to grab feet. We're going to grab, we call them carry-alls. We're going to put it underneath them. We're going to move them as best as we possibly can. And that's scary in the midst of an emergency. Like health emergencies is one thing, but when all of your lives are at risk.
Yeah.
Yeah. It's like I said, we're going to figure it out, man. That's our job. You're calling audibles, basically, is what you're saying. Yeah, we need your creative. So we're lucky, man, because like I said, we're fire-based EMS service. So we have a minimum of 4 people showing up on a call. Sometimes, depending on if it's cardiac arrest, we're going to have, 6 to 10 people showing up. You go to some of these private ambulance companies, they got 2 people showing up. That's it. They're going to call some more people. They're going to call the fire. A lot of times local fire stations will show up. They're just not tied together. So they'll get lift assist, that kind of thing. But there's just some people that they're showing up and response times are bad. EMS is probably at its lowest. It's been in how does one check for their area what the response time is? I'm sure they can look it up, or they can call their local fire department. They can find out, pull the stats. Yeah, that kind of stuff. Like I said, we're 4 to 6 minutes. If you're in a more rural area, then it's probably going to be a little bit longer, just depending on what's going on. Are you oftentimes, again, this is my knowledge from movies, Scott, I feel like I learned everything from television. It took me too. Are you rescuing cats from print? No, come on. Oh yeah, dude. That always felt like if there was misinformation, that's 100% accurate. Yeah. You're really, all right. You know what? The biggest thing that's inaccurate about firefighters, they say that we sleep all the time. They say that's all we do. We play video games and sleep. Do you not play video games? I don't play video games. I have seen it, but we're not going to point that out. I have played a video game a couple times. But the sleeping part is sleep does happen. It is possible. But yeah, it's going to happen at some point, especially when we're on 24 hours. You wouldn't want guys staying up for 24 hours straight. It's horrendous. But the truck I'm on right now, we average 4 or 5 calls after midnight. So we're up all night, that kind of thing. Yes, cats all the time. Really cats out of trees. Yeah. In a month, how many cat calls do you get? That could mean 2 things. Yeah. 16 to 18 per month. I'm kidding, dude. I was about to say, you are now no longer the firefighters. We are cat savers. Cat savers. I would say probably 2 to 3 a year for a year. Yeah, we're not like going out there all the time, but I just pulled one out of a so we get on scene. Thanks for everyone.